We begin with our top story here tonight, a new discovery at Mayo Clinic. Researchers at the hospital are defining a new type of memory loss in older adults, and it is different than Alzheimer's disease. It is known as limbic predominant amnestic neurodegenerative syndrome, or LANS for short. KIMT News 3's Emma Esteb spoke with a Mayo Clinic neurologist earlier today, and she joins us now from Mayo Clinic. So Emma, many people probably have a loved one dealing with Alzheimer's. But who are they seeing these LANS symptoms in?
Yeah, Cami, they are seeing a lot of these LANS symptoms in individuals that are 75 years and older. And so before this criteria, doctors were often misdiagnosing people with Alzheimer's disease or just not knowing what specific things that this person had who was experiencing this type of memory loss. And so this proposed clinical criteria provides a framework for neurologists to classify the condition in patients living with symptoms and providing a more specific diagnosis and potential treatments. LANS is different from Alzheimer's as it only impacts the limbic system of the brain, leaving the rest of the brain perfectly fine. And so the limbic system helps regulate emotions and behavior. It also processes your memory and tells your body how to respond. People with this syndrome would experience many of the early symptoms of Alzheimer's, like repeating sentences or forgetting things, but LANS progresses much slower and is less destructive than Alzheimer's. And so Dr. David Jones tells me why this discovery is critical.
So coming to this higher level of understanding of these different degenerative conditions of the brain is really a required step for us ultimately to understand and cure degenerative diseases of the mind in general.
Dr. Jones also told me that they're looking at a common Alzheimer's medication that could potentially be a treatment for LANS. And again, he said that this is in the very early stages right now. So the new information that they have will be passed along to people that are being diagnosed with LANS. Live in Rochester, Emma Esteb, KIMT News 3.
Emma, so this is really interesting. You're saying a lot of people may have been misdiagnosed with Alzheimer's when they could have been dealing with LANS instead?
Yes, Cami, that's right. And so, like I was saying earlier, LANS often does look like the early stages of Alzheimer's, and so doctors do kind of like to monitor these patients for 2 years because, like, again, I said, LANS progresses a lot slower than Alzheimer's, and so if they're at that 2-year mark and they're seeing a lot less of that memory loss, then they know it's not Alzheimer's and it is LANS. And so another thing that they are also looking at as a potential cause for LANS is a buildup of protein in the brain. And so they've been looking at autopsies brain of these older individuals who are experiencing this type of memory loss as a potential cause. So lots of great information that they are learning here at Mayo Clinic, Cami.
Yeah, a lot of good work at Mayo Clinic. Emma, thank you so much. Now, with this new criteria, doctors are now working to be able to host clinical trials in order to best find the treatment methods for this syndrome. Also a reminder and a fun fact, if you were wondering, Alzheimer's was named after the German doctor who discovered it, Dr. Alois Alzheimer.